If you've ever wondered how intermittent fasting works, what the benefits are, and if there are any risks, you're in the right place. We'll break it all down, so make sure to stick around till the end. Let's begin with what is intermittent fasting. Intermittent fasting is not a diet, it's a pattern of eating. Essentially, it involves alternating periods of eating and fasting. There are several methods, such as the 16/8 method, where you fast for 16 hours and eat within an 8-hour window. Method 2 is the 5:2 diet, where you eat normally for 5 days and restrict calories for 2 days. But it's not just about skipping meals, it's about when you eat. So why is everyone talking about it? Most important reason is the health benefits of intermittent fasting. Number 1. Weight loss. This is a big one. By limiting your eating window, your body burns more fat, especially in the fasting state. Your insulin levels drop, allowing fat cells to release energy more easily. Number 2. Improved metabolic health. Intermittent fasting can lower insulin resistance, helping reduce blood sugar levels and protect against type 2 diabetes. Number 3. Heart health. Studies show it can reduce markers of heart disease, such as cholesterol and triglycerides. Number 4. Longevity. There's even research suggesting that fasting may help increase your lifespan and reduce the risk of certain diseases like Alzheimer's. Risks and considerations. While there are many benefits, intermittent fasting isn't for everyone. Here are some potential risks. Number 1. Nutrient deficiency. If you don't eat enough nutrient-dense foods during your eating window, you could miss out on important vitamins and minerals. Number 2. Disordered eating. Some people may develop an unhealthy relationship with food, especially if they're prone to binge eating. Number 3. Impact on hormones. For women, in particular, fasting can affect menstrual cycles and hormone balance, so it's crucial to consult a healthcare provider if you're considering this lifestyle. Who should avoid intermittent fasting? It's important to know that intermittent fasting isn't suitable for everyone. People who are pregnant, have a history of eating disorders, or suffer from certain health conditions should avoid it. Always check with a healthcare provider before making any drastic changes to your diet. In the end, intermittent fasting can offer some amazing benefits, but it's not a one-size-fits-all solution. If you're thinking about trying it, start slow, pay attention to your body, and always prioritize whole, nutritious foods. You can share your thoughts and comments about intermittent fasting.